Safety and infection control in a safe and effective care environment. That's 12% of the test. All right. What is the number one rule of infection control?
Wash your hands.
Wash your hands. Okay. Which action is most correct after the nurse observes the nurse leaving the computer unsecured? That could be a question in this category. Why? You're trying to make sure that the patient's not just physiologically safe, but is also emotionally safe too, among other things. Which action is most correct after the nurse observes a graduate nurse helping a client with a heart cath to the commode?
You don't do it after a heart cath.
Exactly. So what does the nurse do?
Intervene.
Freak out.
Freaking out actually is not the most helpful thing to do.
Get the patient back in bed, make sure they have pressure, check the site before you do anything.
Yeah. You're going to stabilize the patient, make sure that they're back in bed, laying flat again, make sure that their site's good and covered and has pressure on it. Then what are you going to do?
Teach you.
You're going to teach. Are you going to teach at the bedside?
No.
Probably not for this one. There's lots of times when it's okay to teach at the bedside. This is going to be one that happens outside. Okay? Do you have to do anything else about that event?
Document, but you don't document in the patient's chart. You
would have to do an incident report. Now, what would be appropriate to put in the patient's chart at that point is patient positioned in bed, pressure applied to site, vital signs are thus and such, denies pain or discomfort. That would be appropriate to do for that precise minute, okay? So that's one way that you can cover your documentation without making mention of the fact that something happened. But you do have to, and you might actually have to elaborate on that in the charting, but you don't refer to the incident report that you're going to have to write. And ideally, if that's a nurse who didn't know that, then one of your interventions might be that you sit down together and do the incident report so that you can further discuss why that's an issue. That's a good teaching moment in and of itself. It's not punitive. Does that make sense? The nurse performs what action to best prevent injury, prevent infection, promote wound healing? So what kind of situation might we be in that we want to promote wound healing? Who's got wounds?
bedbound patients.
Yeah. All right, so we have a bedbound diabetic with, let's give them stage 4 chronic renal failure. And how are we best going to prevent infection in that wound? I bet you want them on a high protein diet.
Positioning.
Positioning. Do you want them on high protein?
If they're kidney failure.
I gave them kidney failure.
Are they getting dialysis?
That's a good question. Are they in dialysis yet? We might be able to bump up the protein a tad. Now, we're going to make sure that we're keeping them turned. What else? I mean, obvious. What are you're going to keep it clean and dry.
Dress them a little, yeah.
Or dress it if it's needed. What else?
Specialty bed, maybe?
Maybe a specialty bed, depending on where the ulcer is. What if it's on their toe?
Check pressure, like from the sheets.
You want to try to tent the sheets up off the foot, yeah. Yeah. How many rabbit holes did we find?
A lot.